Hello, welcome to episode 2 of our podcast. We are the Twin Sister Docs. I am Dr. Delana Wardlaw, a board-certified family medicine physician.
And I am Dr. Elana McDonald, a board-certified general pediatrician.
Collectively, we are the Twin Sister Docs, twins, sisters, and physicians. Absolutely.
And we have over 50 years collectively of practice in medicine. And our goal is to make sure we are helping individuals such as yourself navigate, which can often be a complex medical system.
And also helping you to live your healthiest, best life. So let's get into it.
So, Dr. Wardlaw, as we encourage individuals to participate in their own health care, how do we prepare for our upcoming doctor's visits?
Absolutely. So when we go to our visits, we want to make sure that you're doing as much as you can to prepare for the visit. Because as you know, there's limited time once you get in there with the doctor. And what you can do is, 1, know exactly where you're going. 2, if you have to arrange for transportation, make sure that you do that. Make sure you have that lined up. And sometimes your insurance company will provide transportation. So that's something that you should look into prior to your visit as well. They'll allow you to set up those visits approximately 3 to 4 days prior to the visit. So make sure you do that. Also, make sure that you are prepared to take in for new visits and any follow-up visits. Take in your medications, whether it's the bottles, whether it's the slips that you get from the pharmacy, whether it's pictures on your phones, anything that you can do to provide the doctor with accurate information about the medication that you're taking. Also, particularly on your first visit, make sure that you take a list of your medical conditions and your previous doctors who you may have seen, because that allows for the physician to be able to obtain medical records, be able to dive into your past medical history. So making sure you have that information. Also making sure you have any of your specialists' contact information so that we can reach out to them and get information. Also, have your pharmacy name, number, and or location so that we can send your medications over. As we all know, we're in this digital world now. We're using electronic records, electronic files, and we can order your medications electronically. So if you have that information readily available, then it makes it easier for us to be able to send the medication over.
2 other key things you need to come when you go to especially your first doctor's visit, but take it to every doctor's visit. Your photo ID and your insurance card. Those are key pieces of ID and information that we need anytime you go to a doctor's office. So make sure you have that readily available.
Also, make sure you know what your copay is. Now, we as the physicians, we set the copays. We don't set the copay rate. That's your insurance company that determines that rate. And oftentimes it is located on your prescription card, where it will tell you what your copay is to see your primary care physician, what your copay is to go to the emergency room, what your copay is to go to a specialist, what your copay is to go to urgent care.
Yes.
So that information is typically listed on your insurance card. If it is not, please feel free to call member services.
So the insurance company.
Yes, so that you are prepared if you have a copay to pay and you're not caught off guard.
Yes.
So the other thing that we would like for you to do is to, before you get to the visit, if you need translation services, the last thing we want is for a patient to come to the office and we're not prepared to have a translator so that we can communicate with them in an effective manner. So please, if you need a translator for a different language, for sign language, please make sure you let the office know so that they can be adequately prepared for when you come to your visit.
Exactly.
Now, those are all things that you can do before the visit, before you walk through the door. And so now when you walk through the door, of course, and you get in, you're checking at the desk, please, and this sounds simple, but make sure you're checking at the desk. Please just don't go in and sit down, because we have had that happen on many occasions where patients are sitting in the waiting room for 20 or 30 minutes. And then the front desk will say, Mr. Jones, are you here with someone? Is someone that we help you? And no, and they haven't checked in at the desk. So please make sure you do check in at the desk when you arrive.
And when you do check in, also make sure you're updating any demographic information. If your phone number has changed, if your address has changed, and please make sure that we have your email, because we oftentimes may reach out to you or be able to send you things over email. So please make sure all of that information is up to date every time you come into your doctor's appointment.
Absolutely. Also, before you get there, if you want to bring somebody along to your doctor's appointment with you, please do so. Sometimes you come to the doctors and you need somebody there for support. You need somebody there for comfort, or you need somebody there just to help you to understand what's going on with the visit. So please make arrangements to do that as well. And also make sure you have your questions. Yes, make sure you have your questions ready. Because as we all know, many times doctor's visits are rushed. Now, Dr. McDonald, now let's explain to everyone why many times we are running behind. And I know that this may be a little bit off topic, but I just want to jump into this for a second because we have this 15-minute doctor visit, which is really
there is no such thing as a 15-minute doctor's visit. And unfortunately, in this day and age where as physicians, we have limitations placed on us to be able to see a certain amount of patients, a 15-minute doctor visit is going to lead to two things. One, you're going to feel rushed, or two, the physician is going to take the time they need to take with you and they're going to run behind schedule. So oftentimes people will say, well, what's taking the doctor so long? Why is the doctor taking so long? Because we're still trying to make sure that you have the proper care that you need when you come to see us.
Absolutely. So we might not always be able to follow that. Many times we can't follow that 15-minute guideline, and that puts us behind. So just recognize it's not intentional.
We are certainly not making you wait on purpose.
Not intentional. We haven't gone off on our lunch break, but this is the reality of the situation. So when you go in, so you can maximize that time that you have with the doctor, make sure you have your questions available.
Certain things you need to do when you go into your doctor's office. As Dr. Wardlaw said, make sure you have your questions written down, whether or not you put them on your phone or you put them on a piece of paper, which hopefully will not be lost when you come to the doctor's appointment. But make sure you have your questions written down, and also just ask the basic questions. Doc, what is the plan for today? What are we doing? And if the doctor tells you that there's a new diagnosis or anything, you want to know what that diagnosis means. What does that mean for you? How did they make the diagnosis? What is the treatment plan? And you want to make sure that you understand what that new diagnosis means for you and what the plan is going forward. If the doctor is talking to you and you simply don't understand, you need to stop and say, Doc, I don't understand. Can you explain it to me in a different way?
And Dr. McDonald, please say that again. Please say that again, because I think sometimes patients get
intimidated. They think they're asking dumb questions. And as we all learned in school, the only dumb question is the question that you never ask. This is your health. You want to make sure that you understand everything that's going on with your health so that you are able to comply with the recommendations that are being made. So it's very important to make sure that you understand. As Dr. Wardlaw always says, can you draw me a picture? A picture is worth 1,000 words. And as physicians, oftentimes sometimes we may start to use words that we think are simple, but they are complicated for you. And it's okay to say, Doc, I don't understand. We're doctors. That's what we do for a living. But when we go to the mechanic, and the mechanic is talking to us about the carburetor and the transmission and the brake pads, I'm overwhelmed. And I just want to know, can you please simplify the problem? My car is not running. Can it be running by the end of the day? So we too feel that way when we go in spaces that we're not comfortable with. So please make sure you are asking your doctor these questions.
It is imperative that you do that. You're not bothering us. It is our job to make sure that we're answering your questions, because the reality of it is, if you don't have the answer that you need, then that is going to likely decrease the chances of you following the recommendation. So we want to make sure that you understand and make sure that you have your questions answered. Now, there's an acronym that you can use to try to help you to remember this.
What is that acronym, Dr. Wardlaw?
PQRST.
It's part of the alphabet.
Part of the alphabet. P, what's the problem or diagnosis? Q, quantify the problem. Is it a major problem? Is it a minor problem? Is it a moderate problem?
Is it going to self-resolve on its own?
Absolutely. R, results. What type of testing was done? What type of testing is necessary? What results have you received? And what are we looking to find out from those results? S, symptoms. Symptoms, what should I expect to feel? How do I know if I'm getting better? How do I know if I'm getting worse? How do I know if I need to present to the emergency room? So symptoms, signs are some physical changes that may occur in your body that the doctor will discuss with you to let you know if your condition is getting worse, if your legs are starting to swell, if you have heart disease and your legs aren't improving with elevating them, or if you are starting to have fevers. So these are things that signs and symptoms that you need to be able to talk to your doctor about. Say, hey, what do I need to look out for? And then S, next is T, treatment plan. What is the treatment plan? How do we treat this condition? What are the treatment options? Is there an option to not treat it at this time? Can we monitor it for some time and then see what happens there? What happens if I do take the treatment plan? Do I expect to have some side effects? Or what improvement will I see?
And that's very important to stop at where Dr. Wardlaw said, what happens if I decide not to take the treatment plan? So as physicians, it is our job to make sure that we have accurately explained it to you in a manner that you understand so that you are making an informed decision based on the information that you have and you understand the consequences of not going ahead with the treatment plan. But again, we don't want you to make a decision based on information that you don't understand. So please make sure that you understand all of the information that the doctor is providing you before you decide if you're going to go ahead with the treatment or you're going to opt out of the treatment.
Now, here's the other thing. A lot of times when we're in the doctor's office, you may be overwhelmed. And this is why it's important sometimes to have someone go along with you, because you may receive information and by the time you leave out of the room or the doctor's office, you may have forgotten what was said,
Everything they told you
or what was mentioned. So I implore you, one, to make sure that many offices have an electronic medical record system. So they will give you what is called an after visit summary when you leave the office, detailing what occurred during the visit, what your vital signs were, what tests were drawn, what referrals were made, what medications were sent to the pharmacy. All those things can oftentimes be found on that after visit summary document.
However, it's not. Some doctors' offices do not have the capability to provide that after visit summary, but you should still have all the information that you need. What's next? What tests are being ordered? Do I have to call the radiologist to schedule an ultrasound? Why is that ultrasound being done? I need to understand why I'm calling. 2, you want to make sure that oftentimes I will ask the patient, so do you tell me what the plan is? Because I need them to repeat the plan back to me to make sure that they understand. Oftentimes I will pull things up in this day and age of electronic medical records. If I have my laptop in the room with me, this is where you're going to go. Pull it up on it. I want you to take a pictures on your phone. Sometimes we send you out the office with a bunch of papers. You're looking for it the next week. So there are many ways that you can get the information that you need to be able to proceed and to become a team player. You want to be a partner with the doctor in your healthcare.
I have to reiterate that. It is a team approach. The doctor-patient relationship is dependent upon just that, the doctor and the patient. It can't be the doctor making all decisions and the patient not having an active involvement in the treatment plan. So we want you to be able to be an advocate for yourself, be able to ask questions, making sure that when you're not clear to revisit the situation. But I also want you to be aware of that being an advocate for yourself
and being on a team doesn't mean everything goes your way, because the doctor is still the professional, but they still need to hear all of your concerns. But this is not Burger King. Everything is not going to go your way.
Absolutely. So, Dr. McDonald, can mom come into the doctor's office and ask you for an antibiotic for a runny nose?
Absolutely not. And I will explain to mom why we're not prescribing antibiotics for viruses, because it's not indicated and the virus will run its course. But also, I explained to mom why we're diagnosing it as a virus, what symptoms we're seeing, why the child doesn't need to go to the emergency room for further treatment. Everything looks good. However, I also tell my families, if anything changes, if you're starting to notice that your child is looking worse, call us back. These are the things you need to call us for. These are the things you need to go to the emergency room. Because what an illness looks like on day 1 may be very different on day 3 or day 5. So if things change, please reach back out to us.
Absolutely. So again, being an advocate in your care, but also recognizing that, you may ask for something that may not be appropriate. However, the doctor should take that time
to explain why it's not appropriate.
Why it's not appropriate. Not just, it's just a no, we're not going to do that. It really need to take the time to explain to you why that is not appropriate. And again, allowing you to be able to here's what Dr. McDonald and I see very often. We get to the end of the visit and we say, do you have any questions? Many times it's not that patients don't have questions. They just don't know what to ask. They really are not sure of what they need to say, what they need to ask, what they need to do next. So as Dr. McDonald and I Our goal is to make sure our patients receive the same information that we want our family members to receive.
Yes.
Give the patients the information they need so they can make a good, educated decision about their medical care.
Right.
It's just that simple.
And yeah, and again, understanding what are the consequences if you opt not to follow the recommendations of the physician.
And again, you're the captain of the ship because ultimately you make the final decision. We are in a day of medicine where we cannot provide you any treatment without your permission. We cannot force you to take a treatment. But we just want to make sure that you're not declining a treatment because you don't have
all the
information
or you don't understand.
or in the day of social media, receiving misinformation. Misinformation is rampant. And so just want to make sure that, and I'm not just going to blame it on social media, but it's just magnified in social media.
Yes.
Misinformation has been an issue since the beginning of time.
Yeah.
So again,
So our goal is to educate our patients.
Absolutely.
Again, we want a team approach here, but at the end of the day, understand that just because you're part of the team doesn't mean that everything's going to go your way.
Absolutely. And when you get that after visit summary, that document that Dr. McDonald was speaking of when you leave the office, you can use that to take to, if you have to take to a specialist, to another doctor. That document it provides a lot of information that the next doctor can use and will be able to help you navigate your visit.
Right. And speaking of specialists, if a doctor refers you to a specialist, you want to be clear as to the reason why you're being referred to a specialist so that you understand. If a doctor is, whether it's your primary care doctor or a specialist, if they are prescribing a new medication, you want to understand, why am I taking this medication? And then you also still want to understand all the other medications that you're taking. So any medication that you're being prescribed, you want to make sure that you understand why you are taking this medication, the importance of it.
Let's revisit specialist, Dr. McDonald. So oftentimes patients will come into the office or they'll call the office and ask for a referral for a specialist. And oftentimes patients will get a response back, well, you need to check with the doctor for that. Or, have you seen the specialist before? The reason for that is because many times, or a lot of times, patients are self-referring and they may be self-referring to the wrong specialist.
So we want to make sure that there's a proper indication for you to go to a particular specialist.
Absolutely.
Because again, part of our job as a pediatrician and as a family medicine physician is to make sure that all of you needs to be in service, and we want to make sure that you are in the proper place when it's indicated.
Absolutely. And so this is the doctor's office that we're talking about. And so when you wrap up your doctor's visit and you leave out of the office, make sure that you have all the paperwork you need, whether it's referrals, whether it's information for a procedure that you need to get scheduled, whether it is
the next appointment that you need to schedule.
That is key. Before you leave the doctor's office, if you are having chronic conditions that are being managed, or if you have an acute illness that needs to be followed up, make sure you get your appointment before you leave the office.
Because when you leave out that office, we forget. We forget. I'll call tomorrow. I'll call next week. And then 3 or 4 months go by. So please stop at the front desk and take care of everything you need before you leave the doctor's office. And a couple other things about the doctor's office. When you're coming to the doctor's office, we may not be able to address all of your concerns in a particular visit. Remember, there is a certain amount of time that we have for the visit. So we will address the most pressing concern, and you may have to come back. So and also questions come up, you're scheduled for you're scheduled for a well visit. But if you come up with sick complaints, those are two different things that are going on. So you may get a bill later. You may question why. Because when you went to the doctor's office, another issue came up during the visit.
I think that's very important, Dr. McDonald. And we get those questions a lot. Well, why did I get a bill when I came up for my well visit? Well, your well visit really is a visit to make sure that we are evaluating for, make sure you have all your preventive measures in place, checking on your vital signs and making sure that if you have any recommended studies that need to be done for your age, that we're doing that, and we're doing that annual wellness exam. Now, if a problem comes up, that is something separate. Now, oftentimes, if it's not urgent, the doctor can say, okay, we'll reschedule for another visit. Many people don't like that, but the reality of it is, again, we are on a schedule that we are following. Or the doctor can say, well, we can address it now, but then you may get a copay for that. So that is something that you really need to discuss with your insurance company. I understand that if you are talking about sicknesses and other issues during your well visit, what copays are going to come out of that.
Right. And people always say, well, I was at my doctor's appointment. So I always use an example. If you go schedule an appointment with your hairdresser and you tell your hairdresser, I'm just going to get a trim. But then when you get to the hairdresser is prepared to do a trim. Now you want a full new cut, you want it dyed, or you want extensions. That's a whole nother issue that needs to be taken care of. So you will be charged differently. So same thing when you come into your doctor's office, that you have to understand that everything can't be addressed in one particular visit. And if it is addressed in one particular visit, a new issue comes up, or a chronic issue has gotten much worse that needs, a change in treatment plan that may be considered an additional sick visit. So we just want people to understand what is going on when they enter their doctor's office. And one last thing, the hand on the door. Dr. Wardlaw, what's the hand on the door?
The hand on the door. Well, you have spent time with the patient, and most of the time we've gone overtime, and you go to leave out Mr. Jones. Have a great day. We'll see you back in 3 months or whatever that planned time for you to come back. And Mr. Jones said, hold on, doc. I've been having chest pain for the last 3 weeks. Well, Mr. Jones, wait, that's a serious issue that we have to discuss. And so now chest pain is not an issue that I can say, oh, well, Mr. Jones, come back next week. We'll discuss that next week. Now I have to go back in. I have to sit down and I have to discuss with Mr. Jones's chest pain. So hence, here we go. Another 15 minutes.
So to make sure that Mr. or Mrs. Jones get the care that they need. So you want to make sure that when you go into the doctor's office, your most pressing issues are being addressed immediately, because you don't want to wait till the very end of the visit as the doctor's walking out the door and say, hey, I got this other big problem that I need to address.
Absolutely. So again, prioritizing what your main concern is so that could be addressed. And again, this is as to another level of why physicians are oftentimes behind, because we can't keep up with that schedule because we have to address things that come up unexpectedly as well. So that's for the doctor's visit. And I hope that everyone was able to receive some information on how to maximize your doctor's visit, that time that you have with your doctor. Now, you also have to understand when you're in the hospital. That's a different type of experience as well. And one of the key things that we want you to know when you're in the hospital is you get many people in your room during the hospital visit. No, ask everybody, excuse me, can you please tell me your name and what your role is on my medical team? And so that you know who you're speaking with and what their involvement is with your medical team. And then you can ask questions appropriately, or not ask questions, but you know who is involved, who is involved in your care.
Right, because it could be the nurse, it could be the respiratory therapist, it could be the IV team, it could be the physician, it could be the medical student, the resident, the fellow, especially in a teaching hospital. So you want to know who's coming into the room and what part they have on your team, or what part they are on the team to provide you the care that you need.
And again, we say again, it is okay to ask these questions. No one should be offended by these questions. Again, hopefully they're introducing themselves when they come into the room, but if not, please feel free to ask the question. That is totally acceptable, and no one should be offended by you asking that question.
And the hospital is a very stressful time, The emergency room, or if you're admitted into the hospital, people always say, I didn't sleep in the hospital, and always say, when we want you to sleep, we send you home. When you're in the hospital, we need to make sure that you are being properly observed, getting your vital signs, whether or not you need IV fluids, you need your antibiotics, you need to be taken for a test. So yes, it is very hard to sleep in the hospital, but you're there for a specific reason, to make sure that you're getting your specific illness or condition treated. So yes, the hospital is a very stressful time, but you still want to know who's taking care of you, who's on the team.
Absolutely. So again, questions. Do not be afraid. Do not be intimidated. And we as physicians, we owe you the answers. So please don't hesitate.
Yes. Never feel like there's a dumb question. As we always say, the only dumb question is the question that you never ask. And we learned that early on in elementary school.
Absolutely. And when you're in a hospital also, too, going over those same things that we talked about, the PQ, RST, making sure you know exactly what the problem is, problem/diagnosis, making sure that you know what the quality of the problem is, right? Is it a major problem? Is it a severe problem? Is it a significant problem? If you're in the hospital, it probably is more on the significant or the severe side.
And is it a chronic problem that's going to be managed once you leave the hospital, or is it an acute problem that we're going to fix right now? We're in the hospital today, and you're not going to have this issue anymore.
Absolutely. Acute problem, for instance. You go in and you went to the emergency room and you had severe pain in your right lower side of your abdominal area. They evaluate you, do a CAT scan, and you have an appendicitis, and off you go to the operating room. Surgeon takes out the appendix. That's it. That problem is resolved.
Yes.
That was an acute problem that was resolved.
You may have a follow-up visit, and then after that, problem is resolved. However, there may be times you go into the hospital and you are diagnosed with congestive heart failure. They may acutely treat the problem, but that's a chronic problem that has to be managed from here on out. So you're going to need to follow up with your doctor, with the cardiologist. You have to make sure that you understand what the plan is moving forward.
Mm-hmm.
So whether or not you were discharged from the emergency room, or if you're admitted to the hospital, you want to know what the plan is. And if you're admitted to the hospital every day, when the team comes in, question, hi docs, what's the plan for today? What's the plan for the day? And oftentimes you're in the hospital too, talk to the nurses. The nurses know the plans also. So questions, because again, we want you to be a part of the team. We want you to be educated. So please ask questions.
Absolutely. So, Dr. McDonald, as we wrap up episode 2, just want to give a quick tip to remind people that when you go to the doctor's office, to maximize that visit, we want you to prepare on the front end with the things that we discussed, particularly making sure that you have your questions written down, making sure you take your medications along with you, making sure you take someone alongside with you. In the event that you get overwhelmed or you may forget some things, they can help assist you there, and making sure that you get your questions answered before you leave that doctor's appointment.
Make sure you understand what the active issues are and what the plan is moving forward.
So with that, we would like for you to tune into our next episode, which we will be focusing on
trusted resources. Who are they? And will we also be talking about vaccine awareness?
Absolutely. We'll see you then. Thank you for tuning in.